Welcome back. Well, you saw there Breastlink Laguna Hills, but today we have on a doctor from their newest location down there in Newport Beach, right around the Newport Center down there. We have Dr. June Chen, who is a breast-dedicated radiologist. Nice to have you here today.
Thank you for having me.
Yeah, and you're lucky you get to be in their location right down there and Newport Beach. So
it's beautiful.
It's great to have you up here today. But I'm
you.
sure you work with all the locations as
I
well,
absolutely
right?
do, yes.
So today we're going to talk about mammograms. And people often get confused about a lot of things, how often they should have one, of course. But what is the difference between a screening and a diagnostic mammogram? I always thought they're kind of the same.
Okay, so they are different. So the screening mammogram is performed on women who don't have any complaints or breast problems at all. And so a screening mammogram is used to detect early breast cancers before they can be felt by the woman or her doctor. And the reason that this is important is because the earlier that we can detect breast cancer, the less aggressive the surgery needs to be, the less aggressive and frequency of requirement for possible chemotherapy, and increased survival rate. So it's very important. On the other hand, a diagnostic mammogram is performed on women who have a clinical complaint of their breast. They have a sign or a symptom that's concerning to them. And these can be either found by the woman herself, or they can be found by her doctor. Clinical complaints and signs and symptoms include breast lumps. It could be a hardening of the breast. It could be a localized thickening. It could be a focal area of persistent pain that doesn't let up over several months. It can be nipple discharge, or otherwise known as leaking of some liquid from the breast nipple. So any of these signs and symptoms would have the patient be ordered as a diagnostic mammogram. Now the differences are, in a screening mammogram, each breast receives on average 2 views. So 2 x-rays of the breasts are taken for each breast. However, in a diagnostic mammogram, usually there are more than 2 views taken. And the reason is we will take some extra special focused mammograms directly to the area of clinical concern, directly to the area that we need to evaluate further because there's a question of whether or not there's a problem.
So as far as screening goes, is this something that women should start getting in their 20s and beyond?
So that's a very good question, and there is some controversy, and I'm sure that you're well aware in the news there have been quite a bit of controversy. At Breastlink, we follow the guidelines that are set forth by the major medical organizations that have breast cancer experts on their board. This includes the Society of Breast Imaging, the American College of Radiology, the American College of OBGYN. Their guidelines are that an average risk woman begins screening mammogram at age 40. And then they continue the screening mammogram annually. So every year they're to have the screening mammogram. There is no upper age limit, because that's often a question that's posed to me. When do we stop? That's a very individualized answer. So it is generally accepted that when a patient reaches the age of 75, she should have a personalized conversation with her doctor to assess her health, her overall generalized health. If she's in great health, and she could undergo a biopsy if something were to be found, and she has many life years ahead of her, she needs to continue having an annual mammogram. And given this day and age, women and men are living longer and longer, well into their 80s and 90s, and healthy, and keeping fit. And so it's very important for them to continue receiving these mammograms. So there's really no upper age limit. Now, if the patient has other risk factors, such as a very strong family history of breast cancer, perhaps in her mother or sister in her 40s, or maybe even in their 30s, then the patient would need to start screening mammogram even earlier than age
Okay.
40. But again, that's a subset of population, that's a special group of women, and they need to have a personalized conversation with their doctor.
Okay, so it almost kind of follows the same similar type guidelines for men when it comes to colonoscopies. It's like if there's a lot of history in your family, you may start having that sooner. What happens, I imagine it can be very troubling for someone that they go to have a screening and then they are asked to come back. And I would think that in their minds, uh-oh, they found something. So tell us when you would do that and why.
Okay, so I see that every day in my practice, and I'm glad you're asking me about that. Because when a woman receives her screening mammogram, she usually will come into the office and leave, and her results are mailed to her in the U.S. postal mail within 30 days. So she receives a letter from the office and facility. The vast majority of those letters indicate it is a normal mammogram. Your results are normal. We will see you in 1 year.
Okay.
However, about 10% of women will receive a letter that states, we found something that we're questioning. It might be abnormal. We need you to return to the office, and we need to do some more workup. We need to do some more imaging.
Okay.
Now that imaging could be additional special mammographic views, such as a diagnostic mammogram. Now we want those special views directed to the area that the radiologist is questioning, or it could be a breast ultrasound, or it can include both. But what I think is very, very important that I want to stress is that the vast majority of women who receive this letter stating that they need to come back for additional imaging, those prove to be normal after the additional imaging is done. So after the special mammographic views and the additional views are taken, and or after the ultrasound, it's proven that everything's normal. It just needed that additional clarification. Because what happens is, I think women get these letters and they automatically think the worst. They think, oh my goodness, I have breast cancer.
Of course.
And they're not able to sleep, they're not able to eat, they're very stressed, and they're thinking the worst. And so by the time they come and see us, it's really not been healthy for them, even if it's a day or an evening.
That's right, yes.
And because the vast majority of these are normal, I don't want that to happen to our ladies and the ladies. So I think it's really important to remember that.
Okay, that would be true of anyone getting a response after a test saying, you know, we need to look at things further. I'm going to skip ahead here because I think this is an important question. Can you have mammograms if you have implants?
The answer to that is yes, you can. And even more importantly, yes, you absolutely should be getting your mammograms. So not only can you, but you should be. So implants will make it a little bit more difficult to see your breast tissue because there's an implant that can hide portions of it.
Right.
Now the way that we get around that is, as we discussed previously, with a screening mammogram, we ordinarily take 2 views of each breast. But in order to try to move the implant out of the way so that we can see a woman's breast tissue better, we do 2 additional views.
Okay.
So now, if a woman has an implant, each breast receives 4 views.
Okay.
And so that's our way of getting around the implant and really trying our best to still see the surrounding breast tissue around the implant.
Okay, because you're really looking at all sides, but particularly I would say behind, right?
And so
or underneath.
I think it's a good way to think about it is all sides.
Okay.
We want to look at all parts of the breast, and some implants are behind the muscle and some are in front of the muscle. It doesn't matter where your implant is, you should still get your screening annual mammogram, and we do our best to see all parts of your breast still.
Okay, and finally, what about 3D mammography? Is it something that is used during a screening, or is it more for diagnostic?
So a 3D mammography, also known as tomosynthesis mammography, is the newest digital mammography.
Okay.
It can be used for screening or diagnostic. The difference is that it's a series of low-dose mammograms obtained in an arc, and it's so that the breast can be reconstructed in very, very thin slices. What that does is it allows a radiologist to see through the layers of the breast better. It reduces the superimposition, which is also known as the overlap of a normal breast tissue. And that's really important because when there's overlap of breast tissue, it can hide a small cancer. So the 3D mammography does allow us to find some certain types of cancers a little bit earlier. So it's important. It's a really nice new type of digital mammography. And Medicare is covering that cost now as of this year because there is a slight extra cost to it, but Medicare covers it now. So it's something that we recommend.
And now does that mean during a screening, someone would ask for that, or is that done automatically, or when do you decide to use that technique?
The woman's doctor needs to order it, yes.
All right. Thank you very much, Dr. June Chen with BreastLink, and of course they're right over here in Laguna Hills, and June is down in Newport Beach, but she works with all the different areas, and a pleasure to meet with you and talk with you. Fantastic.
Thank you.